Experiencing low blood sugar can be frightening when it happens. But when you understand who is at risk, how to recognize it, and how to treat it properly, it becomes manageable. Hypoglycemia is defined as a blood glucose level below 4.0 millimoles per liter, or less than 70 milligrams per deciliter. Whether symptoms are present or not, it is always important and should never be ignored. Hypoglycemia happens when there is more insulin or glucose-lowering medication in the body than the amount of glucose available in the bloodstream. Not everyone with diabetes experiences hypoglycemia. Some people are at much higher risk. These include people with type 1 diabetes, people on medications that lowers blood glucose, and people on insulin therapy. People with type 1 diabetes are at the highest risk because insulin is essential for survival. But excess insulin can lower blood sugar too far. People with type 2 diabetes can also experience hypoglycemia, especially if they use insulin or medications such as sulfonylureas, like diamicron, glyclazide, or amaryl, glimepiride, that lowers blood glucose. People with gestational diabetes usually have a lower risk, but hypoglycemia can still occur, particularly if on insulin, and there is a delay in eating. Certain situations increase the risk. Missing or delaying meals, eating less than usual, unplanned physical activity, excessively hot weather, alcohol without food, medication or insulin doses that are too strong for current needs. Recognizing symptoms early is critical. Early symptoms are caused by the body releasing stress hormones such as adrenaline. These include shaking or trembling, sweating, palpitations, hunger, feeling anxious or irritable, lightheadedness. Other counter-regulatory hormones include glucagon, cortisol, and growth hormone. If blood sugar continues to fall, the brain does not receive enough glucose. This leads to more serious, moderate to severe symptoms. These include confusion, slurred speech, and at the extreme, loss of consciousness, or even seizures. Severe hypoglycemia is a medical emergency. Not everyone experiences warning symptoms clearly. Some people develop reduced awareness of hypoglycemia, particularly after many years of diabetes. This makes routine monitoring, education, and structured treatment especially important. So how should hypoglycemia be treated? There are well-established guidelines for this. If blood glucose is below 4.0 millimoles per liter, treat immediately. The first step is fast-acting carbohydrate. This usually means about 15 grams of rapid-acting sugar. These include 5 to 6 glucose tablets, glucose gel, glucose drink, Lift, or a glass of sweetened juice. Avoid chocolate or high-fat foods at this stage. Fat slows absorption and delays recovery. After treatment, wait 15 minutes and recheck blood glucose. If it is still below 4.0 millimoles per liter, or 70 milligrams per deciliter, repeat the treatment. Once blood glucose has recovered, follow up with 20 grams of longer-acting carbohydrate such as 2 slices of bread, 2 biscuits, or a meal. This helps prevent blood sugar from dropping again. Recurrent hypoglycemia. If a person is unconscious or unable to swallow, do not give food or drink. Emergency treatment such as glucagon or an intravenous glucose infusion is required urgently by a trained medical professional. Preventing hypoglycemia is just as important as treating it. Having regular meals, consistent carbohydrate intake, matching insulin or medication to food and activity, planning for exercise, being cautious with alcohol. For people with type 1 diabetes, one rule is critical. Never omit long-acting, basal insulin, even after a hypoglycemic episode. These include Lantus, Toujeo, Glargine, and Tresiba, Degludec. Doses may need adjustment, but insulin should not be stopped without medical advice. Repeated or severe hypoglycemia should always prompt review by a diabetes care team. Hypoglycemia is not a personal failure. It is a signal that treatment needs adjusting. When recognized early and treated properly, it can be managed safely. Understanding hypoglycemia protects you, your family, and the people around you. If you want diabetes explained clearly, calmly, and without fear, this channel is here to help you manage it with confidence. If you got value from this video, please like, subscribe, and share with someone who would benefit. Check out my other videos for more diabetes-related content.